Hello? At
Hello.
least,
I
hello.
Yes, I hear you.
Okay, good morning, Sebastian.
I do. I can hear you.
Mhm.
Sorry?
Mhm.
I can hear you.
Okay, perfect. The room is still filling up, but it's time to get started, I guess.
Okay.
Let's get started? Yeah. Vanessa. Too much. Is that normal, the mic? Hello? There's still a lot of, I don't know what it is, but yeah. Anyway, I'll get started. Hopefully they'll figure it out as we go. Good morning, everybody. My name is Celine Termote. I'm working for the Alliance of Biodiversity International and CGIAR. I'm currently the team leader for Africa in the Food Environment and Consumer Behavior Research Program. I wish you all very welcome to our session on food biodiversity. To fill healthy plates. Yeah, that works better, but can I?
Yeah, I feel too. Sit down. Yeah, maybe sit down.
Can I just get it? Yeah, that's fine. Yeah, this works better in any case. So I wish you a very warm welcome this morning. Thank you for making it that early. It's not a given. So globally, poor quality diets are associated with 11 million premature adult deaths, where healthy diets are not affordable for about 3 billion people. Diets worldwide become increasingly homogeneous, dominated by staple crops, rich in energy but poor in micronutrients and other protective compounds. Everywhere in the world, people are not consuming enough nutrient-rich foods such as fruits, nuts, seeds, vegetables, and whole grains. And as a result, people often do not acquire adequate amounts of the full range of nutrients essential to human health, leading to hidden hunger, malnutrition, and non-communicable diseases. So the current investments in our food systems transformation to increase production and incomes and livelihoods are not sufficient to improve low-quality diets. There's a strategic shift at CGIAR to focus on food systems, and this shift challenges us to consider how our innovations also contribute to improved outcomes for consumer households in rural as well as urban areas. The role of the retail food environment is hereby crucial as it is one of the important drivers of food choices and consumption on the one hand, and can also be considered as the results of all the decisions we make in production and value chains. So this session will address the following question. How can our food system produce enough diverse, nutritious foods and make them available for consumers in rural and urban settings to have access to affordable, safe, and nutritious food? We have only 90 minutes, so we'll have some very short presentations, one after the other, and then we will have time for a questions and or a discussion. We'll see what the time will allow us, basically. So we'll start with some presentation on co-creating in a rural fragile dryland context in Turkana County by Francis. We'll have a presentation on urban vulnerable settlements by Christine Chege. We'll have a presentation on voucher distribution for access to healthy foods by Alan de Brouw. A presentation on informal dairy vendors, milk safety and child milk intake in Kenya by Jeff Leroy. The end-to-end approach and solutions to increase fruits and vegetable consumption by Neha Kumar. And finally, an online presentation on banana diversity by Sébastien Carpentier. So I'm kindly requesting that you take note of your questions so that you can ask them once we are done with the presentations. 90 minutes is not too much, so we'll give the word to Francis right now so he can start his presentation. You can also do it from there, given that the mic not works.
So, good morning, everyone.
Good morning.
My name is Francis Odwor. I work for, can you hear me? Is it okay? I work for the Alliance of Biodiversity International (CGIAR) as a postdoc research fellow. And today I'm very excited to share our research on co-creating for diversity in one of the most fragile areas in the Eastern African region, in Turkana County. And this research focuses on or examines how co-creation can be used to build resilience of communities living in these challenging environments. So the research is conducted in partnership with Save the Children and with the funding from GIZ. We can move next. So it is projected that by the year 2050, there would be a decrease in agricultural yields by up to 30%, with significant challenges being experienced in the dry areas in the Horn of Africa, where already almost 6 million people are facing acute food insecurity. And Turkana is one of the most affected areas due to challenges of infrastructure, climate, and also culture. So this research by itself addresses a critical research gap in climate information on how co-creation can be used to enhance or build climate resilience in these challenging situations. The study is by itself is conducted in a very challenging context, in that it's conducted during that period when the county, the research area in the northeastern part of the country was experiencing extreme drought conditions following 5 failed rainfall seasons, and also immediately following the COVID-19 pandemic. So within this research, we hypothesize that when we work with this community, and in this context, we define co-creation as working with the communities to generate information together and come up with solutions. So we hypothesize that working with these communities, we can be able to identify interventions and then implement them, and then be able to fight or buffer them against the challenges that are being experienced in the county due to climate change. So can we go next? So the slide before. So to do this, this research we followed 6 steps to co-create with the communities, starting with first giving them some nutritional education knowledge, so that they have like a common understanding of the challenges of nutrition in this county. And then we went ahead and then conducted disseminated information that we collected from a baseline study with the community, and followed with a third workshop where barriers to data diversity in the community. The fourth workshop focused on identifying potential solutions together with the community in the workshops. And then in the fifth workshop, we identified particular activities that were then supposed to be implemented. The final workshop, the sixth workshop, not shown in this diagram, involved just planning and putting this in an action plan that was then implemented. To assess the impacts, we worked with 17 communities, and 10 of them were randomized to intervention and 7 to comparison group. and then conducted a baseline assessment in 2020, followed by the implementation of this program for 1 year. And then in 2022, we conducted an end-line assessment. Next. So during the co-creation, we selected 3 types of intervention: the kitchen gardening, which was selected by 10 communities, and then also village savings and learning, worked with in 3 communities, and finally poultry farming that were identified in 2 communities and implemented. The implementation by itself reached 11,000 communities, and 387 farmers were trained on kitchen gardening. We set up a central demonstration garden in each of the locations. As you can see in the photograph, this created some kind of a green oasis in the desert, where even during the extreme drought, something green was seen in Turkana County. Next. So the findings at baseline, we did not find any difference between the intervention communities and the comparison communities. But then, as expected, due to drought, there was a decline also in dietary diversity of these communities, both intervention and control. But then something that was striking is that the communities in the intervention group were able to maintain mostly the good dietary diversity, as you can see with the red line always staying almost stable in the diagram. And also, most important is that we also saw that there was a division of benefits across both people who were participating directly in the intervention and those who were just within the intervention communities but never participated maybe directly. So in a nutshell, we were able to see from this that there was some kind of buffering effect due to the co-creation and the implementation of these interventions in the community. Next. So in what we see from this is that there is an opportunity and some insight for future research is that we could do some scaling of this co-creation methodology in other dryland contexts so that we can see how it performs in other areas as well. There's also an opportunity, or there's also an insight that we can do some longer term studies, especially if we want to assess the sustainability of these interventions. Even though our assessment we did like 6 months after the end of the official of the formal implementation period, we still believe that we can do even more longer term. So this is also important that we can do an economic analysis so that we can be able to ascertain the cost benefits or the cost benefit effectiveness of this intervention or co-creation approach that we applied, but also to be able to study some diffusion pathways so that we're able to identify the best ways to maximize these spillover effects in future. So in conclusion, we can see that this approach worked well, and then we would like to thank the communities and all of you for listening to this presentation. Thank you.
Thank you very much, Francis. Thank you also for sticking to the time. Over to Christine.
Thank you, Celine. Yes, it's working well. Good morning, everyone. My name is Christine Chege. I'm also with the Alliance of Biodiversity International in SEAT. And I'm going to present some highlights on some of the work we've been doing in Kenya. And these are some findings from different studies or different research that we've done in Nairobi, Kenya, from several informal settlements, and also in Kisumu, and also some rural areas, especially from Makueni in the lower eastern part of Kenya. So when we think of supplying foods to the consumers, both urban and rural areas, the big question coming is what is the role of the private sector? And how are these private sector, and when I talk of private sector, I mean this micro, small, medium enterprises, how are they able to supply or not to supply nutritious foods to consumers, both rural and in urban areas? And as we see in those photos there, on the left-hand side, we have photos from urban areas in Kibera, in Mathare, and also similar kind of environments in Kisumu. And also we see in the rural areas, the photos there showing some rural areas in Makueni, and we see there is a lot of food supply or rather food offering, especially fruits and vegetables. When we talk of the small, micro, medium, yes, next please. When we talk of micro, small, medium enterprises, we are talking about different vendors, different categories of food suppliers who are offering these foods to rural areas, to urban areas. And when we look at this study, which we did in Kisumu very recently, we see there's a wide distribution of these kind of vendors, and the highest population there is a kiosk or the small retail shops that offer different kinds of foods. We'll see in the next slide. And then also we have the roadside vendors who are selling different kinds of foods with a lot of vegetables. And also we have some formal outlets like supermarkets, although there are quite few. Next, please. If we look at, so in this line, we are trying to see, we looked at the data from Mathare and Kibera in Nairobi. Those are the some low informal settlements, low income areas, informal settlements in Nairobi. And also we looked at some research in Kisumu. And we're trying to understand what's the role of women and youth in those businesses. So if you look at the graph on the left-hand side, we see 80% of the retailers who are the owners of those businesses are women. And on the right-hand side graph, you see that 40% of the retailers are actually youth. So they are around 35 years and below. So that shows there's a contribution and there's a role and there's a potential to have youth and women employment, especially in Kenya. Let's go to the next one. So here we're trying to see, we've seen there are different types of vendors or the MSMEs within the food environment. And so for this specific case, we look at the data from Mathare and Kibera. Those again, low informal settlements. So we are categorizing here by different food groups. And we see, for example, the bar in the box in blue, that is the kiosks. We see they're selling a wide diversity of foods. And you see the first percentage on top there, 25%, that's mostly cereals. But then if you look at the box in red, the next one, which is vegetables, it's very low. So they have a very small percentage of their offering, which is vegetables and fruits. But if you look at the lower part of that box, you see there's a lot of sugars and sweets and spices, condiments and beverages, which are quite often sugar-sweetened beverages at 18% of their offering. You can go to the next bar and you see we have the supermarkets. They have also a wide diversity of offering for the fruits, for the different commodities, but then they also, for the Kibera and Mathare specifically, they don't have vegetables and fruits. And on the right-hand side, you have tabletop vendors who are offering mainly, over 90% of their offering is fruits and vegetables. So that's showing their importance within the food environment in terms of offering those kind of foods. Next line, please. Then we try, in the next line, we try to dig deeper into, next line, please. We try to dig deeper into the unhealthy food. We've already finished. We try to dig deeper into the unhealthy foods and to see, when we talk of the unhealthy foods, can we understand what are some of the foods that are offered in by those vendors? And you see I'll concentrate on the right-hand side bar, which is graph, which is in orange. We see there is a lot of, okay, the box there is covering the percentages, but I think it was more than 80% or, 30% or so, which is mandazi. Mandazi is the dumplings that are deep fried, made of wheat. And then we see the biscuits are also very many, sweetened beverages quite a lot. And we see all the way going downwards a lot of, and what we classify as unhealthy foods are actually offered by these outlets. Next, please. So in summary, in terms of, previous, please. Yes, in summary, in terms of importance of informal retail markets, or rather the vendors, whom we call the MSMEs in the food environment, we see they are quite important, like I've mentioned, in terms of offering healthy foods, but also we see they're offering a lot of unhealthy foods. they are very close to consumers. That means they make an influence on what consumers are actually consuming. And then also they sell their food in terms of small portions, which is very favorable to consumers in the low-income areas. And quite often, because they are known by the people who live in those areas, they offer food on credit. So that means they are very preferred by those consumers. At the same time, we've seen that the MSMEs are an important source of livelihood for youth and women. And yet, also the formal setups like supermarkets don't have nutritious foods, a lot of them. And the last 2 points I wanted to emphasize there on the importance of including informal markets and informal actors and these kind of vendors when you're thinking about food policy. And then also in terms of us being more conscious about and knowing that these ultra-processed foods are actually available in these informal selling points. So we don't just think that we only have healthy foods. Last line, please. Then finally, in terms of the challenges, when we look through the different studies we've done, we see, yes, these vendors are providing a lot of nutritious foods, but they have a lot of challenges, which directly affect the diets that are, or the foods that are consumed by these people within the informal settlements. First issue is the food safety issue. A lot of food is, there's a lot of food safety issues in terms of contamination, in terms of preservation methods. And then also there is the issue of commodity quality. A lot of food is affected in terms of how it's transported and handled. There's a lot of food waste and loss, again, because of the infrastructure and also because of transportation, infrastructural issues. And for most of those food, we don't have traceability. You don't know where the food is coming from and who has handled it and where it's going. Thank you very much.
Thank you, Celine. I'm going to talk about voucher distribution for healthy foods in 3 different countries, Nigeria, Vietnam, and Tanzania. And this is done with a whole host of partners that made this research possible. So I want to thank them just broadly right now. Go ahead. So I have 2 research questions that I want to ask in this talk. One is, will providing coupons or vouchers for healthy foods increase the consumption of those foods? Since it could also just substitute away from other, it could substitute for spending on those items. So that is a research question that we have to cover. In Vietnam and Nigeria, we largely put fruits on the coupons, and in Tanzania, we studied shelf-stable milk, unflavored yogurt, and eggs as the products that were available. And then the second question is, if we provide the coupons for a quote-unquote long time, the long time was, I think, 5 months in Vietnam and Nigeria, cut off a little bit by COVID. And then in Tanzania, I think it was more like 2 or 3 months. I forget exactly. The project ended, unfortunately, and we couldn't get it extended. So the long time, we want to know if it habituates consumers to using them. And we're going to look at surveys that were done for 4 months in Vietnam and Nigeria after the coupons were stopped, and 9 months in Tanzania. So we're reporting, these are all randomized trials, just to say. So we're comparing to a control group that didn't receive coupons. Next slide. So we had to figure out a ton of implementation details. And to do this, we had to decide on a coupon size. Did we give a coupon a percentage discount? Did we give a value discount? How do we vary it? Do we do discounts? Do we vary the design of the coupons? Do we vary the products? How long should they last for? We had to address seasonal availability. We had to think about what type of vendors to work with to make sure we weren't changing consumer behavior in too many different ways. How do we pay back vendors efficiently? We had to work on that in all the countries. We had to think about counterfeiting, of course. Our Nigerian colleagues had really clever ways of getting around that. And we had to design coupons. Next slide, please. So we solved all those problems before we did the trials. Next one. So just to show you, this is what the coupons look like in Vietnam and Nigeria. That's not the final coupon in Tanzania. If you look very carefully, you'll see the Vietnamese logo in the middle of the coupon. That was a prototype that we had made. Next slide, please. So I'm going to go quickly through these results. The first one is whether households did use the coupons or not. I'm just showing you Vietnam and Nigeria because that was easier than trying to get 3 graphs onto one slide. In Vietnam, the answer was pretty much yes. We had a little bit of an issue getting the project started, so there were some distribution issues in the first few weeks in one of the two sites, but the larger coupons you can see there's a little bit more demand for until week 18 of the project, when there were Delta variant COVID lockdowns and people literally couldn't leave their houses to use or distribute or anything the coupons anymore. So that's where that drop off took place. In Nigeria, we found that about 90% of all the coupons were used pretty much from week 3, when the distribution hiccups ended, and moving forward. And the number in Tanzania is roughly the same, though we had about 90 to 95%. So people actually, if you give people coupons to use for fruits or vegetables or healthy foods, will they use them? Answer is absolutely yes. Yep. Next slide, please. So the first set of results I want to show you are impacts during the intervention, and I'm going to use the number of fruit categories in a household dietary diversity score as the first for Nigeria and Vietnam. There are 3 categories. So we're just counting as 0, 1, 2, 3. This was in a monitoring survey that took place during the intervention. And we see that there are really big effects in Nigeria of about a half an extra fruit type per household in the control groups, in the treatment groups rather. And we don't really see an effect in Vietnam, and that's because the control mean is already 2.6 out of 3. So they're already almost eating all 3 of those varieties. In Tanzania, we're going to just measure the days per week people are consuming eggs, milk, and yogurt relative to the control group. There was one size of coupons in Tanzania, and we see that the control means are less than a day per week for all of those, and they go up. And actually, if you look at what people chose to use the coupons on, you see that pattern right here. They didn't use it nearly as much on the yogurt, but they used it on the eggs and the milk. All right, so here's the surprising result. Do we observe any lasting impacts 4 or 9 months later? 9 months in Tanzania after we gave away coupons for 2 or 3 months. And the answer is actually, if you don't look at our at some of the real complicated statistics we did, the answer in Tanzania is actually yes, they did. We're showing expenditures on coupon fruits in Nigeria and Vietnam, but we're seeing, and we didn't ask about expenditures because we thought there'd be no way in Tanzania, but they're actually eating eggs a quarter of a day more likely. They're more often per week, and 0.2 days per week on average they're consuming milk, and nothing on yogurt. That doesn't surprise us given the popularity of yogurt. In Vietnam, we see that about 24,000 dong an impact of about 24,000 dong per week of expenditures on fruit. That's about $1 per week. Yep. And in Nigeria, we see nothing, basically. So how do we take these results? Next slide, please. So we see one, that yes, households redeem coupons in large numbers during the interventions when you give them coupons to eat more fruit or shelf-stable milk or eggs. We observe positive impacts generally while coupons are being distributed on consumption of those foods. That shouldn't surprise us. But then we do see some evidence of persistence in Vietnam and Tanzania, but not in Nigeria. And we hypothesize this is a liquidity effect, that those households were just not very liquid, didn't have the liquidity to continue buying. But the households in Tanzania are quite used to eating out. The men and the children tend to eat 1 meal per day in that slum area, Temeke. For those of you who know Dar es Salaam, they tend to eat a lot out. And so it's maybe not surprising that we were able to kind of shift a little bit of behavior. Thank you.
Thank you, Alan. Over to Jeff.
Thank you, Celine. I will be presenting, we're coming back to Kenya on a project that was led by Ilri, but I will be presenting it for you today. IFPRI was involved in the evaluation of this project. It's called More Milk. Next slide, please. So the motivation for this study was that informal vendors in many of the countries we work in are the primary source of food for low and middle income households. We also know here in Kenya that informally traded milk is often unsafe and prone to adulteration. So professionalizing that informal sector holds promise not only to make the product safer, but also to encourage its consumption. Next slide. So the More Milk intervention had three parts. It was implemented in Eldoret and here in Kenya, as I mentioned. So vendors were trained for 15 hours on how to handle milk safely, but also how to get better business skills, how to promote their product with customers. The project also visited the vendors anonymously twice. And took a milk set. Well, they purchased milk and then the milk was tested, and the results of that milk testing were then given back to the vendors a week or 2 weeks later with some feedback on what to improve. And then there was a milk marketing campaign. So marketing materials were developed and provided for free to the vendors. These included posters and stickers and calendars that they could hand out to the customers. Next slide. So this was another RCT. We've seen a few today. So we recruited vendors, clusters of vendors. We first conducted a census, then identified vendors, recruited them into the study, and the vendors who agreed, we then approached customers of those vendors and asked them if they wanted to be part of the study as well. After conducting the baseline, we allocated the vendors to either the treatment or the control. In the top kind of horizontal flow, you see these three components of the intervention that I mentioned: the training, the testing, and the milk marketing campaign. In the control group, nothing happened for a year, but then the training was offered at the end. So after we conducted the end line survey, and the difference between the baseline and the end line was about a year. Next slide. So who is the study population? The majority of the vendors we worked with are female. You can see they're small sellers. They sell about 103 liters per milk per week. And businesses are relatively young. There's quite a bit of turnover in this line of work. And then the households who we recruited had on average 4.4 members. The children were 12 to 4 years of age. That was a selection criterion because we wanted to study milk intake in this age group. And then 64% of these households using the household food insecurity access scale were moderately or severely food insecure. Next slide, please. So we're going straight to the impact results because I only have 7 minutes. So we looked at impacts at the vendor level and at the household and child level. So we'll start at the top. Milk safety was a primary outcome. It was assessed as total bacterial count and enterobacteria count. And these are logs, so it's a bit hard unless you're really good with math to figure out what this means. But if you go to the right side of the last column of the table, you see the impacts and you see no stars or no bolding, which means that we didn't find a significant effect in the food safety of the milk. Now moving to the second table, the impact in children. We have a few different outcomes here. The first one is a mean adequacy ratio of 3 nutrients that are important in milk. The bottom line here is, thank you, that milk intake improved by or increased by about 40 mLs per day, which is a 12% increase relative to the baseline consumption. We were also worried about, sorry, can you go back, about diarrhea and substitution, that maybe parents would give more milk and then reduce the intake of other nutritious foods, but that didn't happen. So those outcomes were not significant. Next slide. So as you know, if you've seen, we found no impact on the microbiological quality of the milk. And we think that might be the consequence of the milk already being contaminated when it reaches the vendor shops. So subsequent work would need to involve the higher up parts of the value chain. And then for children, we did find a nice increase in the consumption of milk. And this is really nice, especially for the nutrition world. This study contributes to a relatively small body of work on using market-based interventions to promote the consumption of healthy foods. And then one last slide, because I think I still have a minute. So on policy impact, this project has really gone well beyond its original kind of intent. The Kenya Dairy Board has really embraced the results and is now rolling out this intervention at a much larger scale. And there was a launch, I believe, last week, which was all over the Kenya news. These are just 3 clippings from newspapers, but they were on national television and newspapers and whatnot. And I take no credit for this because this is entirely ILRI's work. So IFPRI has not been involved in this policy impact, but it's an impressive result. Thank you.
Thank you, Jeff, and giving us 1 minute back even. Neha, over to you.
I have 10 minutes.
10 minutes for the
11.
Thank you. Great. Hi, everyone. I'll be talking about the end-to-end approach, the fresh end-to-end approach. I'll talk briefly about the approach and then give an example from a study in Sri Lanka. Thanks. So I'll just start with the challenge statement. So why do we need an end-to-end approach? As Celine pointed out in the beginning, worldwide intake of fruits and vegetables is low, and it's contributing to poor quality diets and high prevalence of malnutrition and diet-related non-communicable diseases. And some of the key barriers include availability. So there's a gap between supply and demand, in part due to post-harvest losses, accessibility. Often consumers, especially the most marginalized populations, are not able to consistently access healthy foods. And then affordability, low-income households coupled with high costs of fruits and vegetables leads to low consumption of these foods in diets. And then lastly, desirability. So people like to eat the foods they eat, and preferences plays a big role in what they're eating, which leads us to the need for having. Next slide, please. So what we do is we start with the diet. We look at the plate and see what it looks like. If it's not optimal, we try to understand some of the constraints, the behavioral constraints. Why are people not consuming? So kind of trying to get at the desirability aspects, and then also the physical and the resource constraints. So is it affordability? Is it an environmental constraint? So this is kind of understanding the demand side of things. Then we go and look at the food environment. I really like this graphic if the food environment would be in the middle, because that's really the interface between the demand and the supply side. So you understand what's going on in markets, what kind of foods are available, and how it's handled, what are the vendors doing. And then lastly, you go and understand the production side of things. Is the production not high enough? What are some of the constraints of low production? Is it seeds? Is it bad suboptimal practices? Is it post-harvest practices that can be improved? So this is what we try to do. We try to look at the consumers, the production, as well as the food environment, and approach it with this end-to-end approach. Next slide, please. So these are the 4 focus countries where we are trying to do this. And if you can click through one more time. Tanzania and Sri Lanka are the countries where we are setting up evaluations to really understand whether the end-to-end approach works. And I'll talk about Sri Lanka in specific to kind of walk you through what we mean by setting up an end-to-end approach and evaluating it. We are still in the process of setting things up, so I won't be presenting any impact findings today, but I'll just kind of try to walk you through how we've set it up in Sri Lanka specifically. Next, please. You can click on one more time. So the motivation for this fresh approach in Sri Lanka, so similar to the worldwide challenges, dietary intake of fruits and vegetables in Sri Lanka is really low. 68% of Sri Lankan adults do not consume the recommended 5 servings of fruits and vegetables. Agricultural production of fruits and vegetables is also not optimal, so it could increase. And lastly, since the economic crisis, in particular, affordability of diets of safe, nutritious fruits has been a major concern. So which kind of leads us to Sri Lanka as a good case for setting this up. Next. You can click through one more time. Can you click one more time? All right. So these are the activities in Sri Lanka. So the middle one is the supply, which is really based on a production hub approach, where trainings are provided on good agricultural practices identified through participatory adaptive trials in demonstration plots, transferred to farmers via farmer field days. And the things that are addressed are integrated water, nutrient, pests, and disease management. We also look at food safety aspects and post-harvest practices. And then seed distribution is also part of the supply side package. Then this is flanked on either side by demand and food environment activities, which are currently being designed. So we've done a baseline survey to understand the context. And based on that, and also we've done some desk reviews and are now in the process of using a co-creation process to design some interventions that will increase the demand for nutritious foods, as well as make it more accessible and available in the food environments. Next, please. So we designed a cluster matched, partially randomized control trial to answer this particular question, which is, what are the impacts of these fresh supply, food environment, and demand activities on production of vegetables and dietary intakes of fruits and vegetables among men and women? And to understand if there are contextual differences, we sampled in the rural as well as in the urban areas. So we have study sites in both the areas. The urban area does not have a production component, so we only look at the effects of the demand and the food environment interventions there. And then just to kind of reiterate the aspect of food environment assessments, it's not just a household survey where we are collecting data on diets and production, but we kind of do an assessment of what's available in these environments, what kind of foods are available, what are some other constraints that the vendors are facing in trying to provide the best food possible. Next slide, please. So as I said, this is just the baseline survey. We collected data. So we have a household survey, which is a standard socioeconomic survey, collected information on the demographic information, assets, shocks, crop cultivation, consumption and expenditure, drivers of food choices, and food and water security. We also did a 24-hour multi-pass dietary recall survey among men and women. And also a food and vegetable consumption frequency questionnaire. And then, as I just said about the food environment assessment, so we did a census of market and retail outlets, and then monthly surveys of market vendors, trying to understand what kind of foods they're selling and what kind of marketing and food and advertisements they have. Next, please. Can you go to the next one? And then click one more time, please, sorry. And another time. So this is showing the food expenditure data from our survey. And you find that share of food expenditure devoted to fruits and vegetables is pretty low. So I think it's a little less than 20% overall. Can you click through one more time? And one more time, sorry. So, and we did some comparisons of rural and urban residents, and we find that urban residents spend more on meat, poultry, and fish, milk and dairy products, and eggs. And when you compare rural and urban residents spend less on leafy vegetables, fruits, oils and nuts, and grains. So it just kind of gives us some context of how urban versus rural consumers are spending their food expenditures. Next slide, please. Can you click one more time? And this is showing the data on what kind of fruits and vegetables are cultivated by households. And we find that 31% of the households are cultivating fruits and about 36.9% of the households are cultivating vegetables. So there is quite a lot of cultivation of fruits and vegetables in our sample. Next, please. So just a quick snapshot of the dietary intake data. So we find, the usual things that we see, lots of, everyone is eating grains, everybody is eating other fruits and vegetables. What is stark, if you can click one more time, is that there are some differences across men and women. So women are more likely to be consuming other fruits. They're more likely to be consuming pulses. and also more likely to be consuming dairy. So which is in a way good. Can you click through one more time? One more time. All right, so this is the census of the food vendors. So if you can see the dots, this is like all the vendors, and the green dots are showing vendors that are selling healthy foods or fruits and vegetables. Can you, next slide, please? Another one. All right, so we estimated the cost of a healthy diet using the data from our food environment assessment, and we find that in the rural areas, it's about 311 Sri Lankan rupees per day, and urban areas, it's less. And the proportion of a healthy diet, cost of a healthy diet that should be devoted to fruits and vegetables is about 34%. If you compare this with the household expenditure data, we know that this is nowhere near what the households are actually spending in terms of percentages devoted to fruits and vegetables. And just in overall, we find that given that they're already spending about 14,000 Sri Lankan rupees, this is very affordable. So there is, I think we can make improvements. And I think I'm out of time, so I'll stop here.
Thank you very much, Neha. Now we will have our online presenter, Sebastian. I think you,
Can you
I
hear
don't
me?
know.
Can you hear me?
Yes, we can hear you.
Okay, perfect.
Okay, will you share your screen or do you want us to click through?
Actually, I was already sharing because there was an issue online. We were not seeing the slides anymore. So it should be
Okay.
fine.
Okay.
Let me just hide this control here. Yes, excellent. Can you see the screen from your side? Celine?
We see a screen.
Okay, perfect. Perfect.
Okay, you have to put it in presenter mode, I think.
I am presenting. You don't see it?
Is this our screen or is this yours? Stop
Do you
share.
see my screen or you see your
No,
screen?
we are seeing the room screen.
Oh, well, then you should restart. I will stop sharing and then you should share again.
1 second, Sebastian.
Yeah. I stopped sharing.
Now you can share.
I can share again. Okay. You see it?
Yes,
Okay, perfect.
10 minutes.
Yeah, let me just hide this floating. Yes, right. Okay, so we have seen several different foods, and I was happy to see that banana was in the top 5 of popular fruits in Sri Lanka. But basically, we all know banana as a very starch-rich fruit, especially if you eat it as a cooking banana, if you harvest it unripe. And I will tell a story here that luckily there is lots of diversity in banana, and banana can not only combat, let's say, the real hunger, but can also be used to combat the hidden hunger, thanks to the diversity there is in the bananas. So my colleagues have done an excellent job in collecting during 40 years already bananas from all over the world. So we have more than 1,700 different bananas in our gene bank. And they do a perfect job in conserving this and in managing this. But it cannot be like a dusty library. We need to know what we have been collecting. We need to know the value of it. And one of those values is, of course, the nutritious value. So we have a great team that does research on climate resilience, on disease resilience. But we also discovered that amongst the great diversity in bananas, there is also a diversity in vitamin A content, as you can see here. You can see a dessert banana, typical, that has vitamin A, but relatively low. And then we have discovered that amongst the great diversity, we have bananas that have at least 10 times more, sometimes 100 times more provitamin A in them and they can be a great asset in having that. You see here some measurements of all the different diversities. So on the bottom right here, you see more or less the provitamin A content of a normal dessert banana, let's say 50. And then we have bananas that go up to 10,000. So that's quite a wide range of diversity, as you can see in provitamin A. And then, of course, you can work together to see what is locally working. I heard in the previous presentations, availability, affordability, desirability. Well, desirability is a very, very important one. I have shown you that we discovered we do have diversity in terms of nutrient content and in terms of vitamins. But how can it work locally? So how to produce enough diverse, nutritious foods supporting healthy diets? It's by co-creation, as has been telling also other people's. Yeah, you need to talk locally what works and doesn't work. And luckily, we have developed also some nice citizen science, participatory research. If you talk to communities, you can discover a lot. And if they can produce it locally, it also helps quite a lot. So that's what we have been basically doing. You see here two examples from a possible introduction in the east of Congo and in Burundi. So we went to communities, we talked to them, we introduced what we thought would make sense, and then together we are discovering what works and what doesn't work. But of course, climate change diseases also play a big important role. You can discover a nice variety which is very nutritious, but of course, if the environment is not right to do that, it's a big challenge. So here you see an example from 20 years ago, where scientists had a different approach, and we tried to say from our perspective, look, those varieties from our gene bank, they're quite disease resistant. Let's introduce them here. And there was a case of Tanzania 20 years ago. The Belgian government and the Tanzanian government introduced disease-resistant bananas in the Bukoba area. We went back more than 20 years later into those areas, and they were still present. And so 8 were still present, and 2 of them even belong to the top 10 most popular varieties. But some of them, like in Uganda, were not present anymore, and some were very popular in Tanzania. So this nicely illustrates that, yes, we can offer solutions. In that case, they were disease-resistant varieties. And yeah, you need to see what locally works and if it can be locally produced or not. So for this survey, we surveyed more than 1,000 farmers. So basically, what's the idea? The idea is that we set up seed systems, local seed systems, of what is locally adapted to the local climate and the future climate, that is locally resistant or tolerant to the current diseases. And of course, very important, what is locally appreciated in the local communities, because otherwise it will not work. Some other factors, so how do they look like and how is the yield? So here you see an example of a high provitamin A kind plantain. And of course, the diversity, how they look like. Here's another example of another plantain. You see immediately here that the yield potentials can be less, right? And this is an alternative for a kind of cooking banana. This is an alternative for a disease banana that has a higher provitamin A content. And this is one of the types that have the highest provitamin A contents. But as you can see, the yield is rather low. So you need to see all aspects. We need to keep on working further on crop improvement. And that's how we can continue together with the local people. There's lots of diversity, as you can see. This is the Zer banana that was produced massively before the Panama disease arrived. And this is, for instance, a banana that is really like having a nice sweet sour taste as apples. We call them apple bananas. Many, many more diversities, and that you can discover locally with the local people what works and what doesn't work. So the message is, we have the diversity, we have the science to develop climate resilient varieties, disease resistant varieties with higher nutrient contents, and let's test it out together, what works and what doesn't work. Thank you for listening.
Thank you so much, Sebastian. Thank you to all presenters for sticking to the time. This gives us at least like half an hour to open up a discussion. So I would first of all like to invite all the people present, and our room nicely filled up today, so very happy about that. Somebody who would like to ask some questions, either clarification questions or either something you would like to discuss with the room. Namukulo.
Thank you. My question is to Neha. Thank you. I was in a room the other day where I had to put it right next to my nose to be heard. The thing is, Neha, when you make the presentation in terms of the consumption from the expenditure data on the vegetables, it was very low. And then when you presented what proportion of the households were growing vegetables, that was much higher. So my question is, did you explore whether they were consuming things from their home gardens that may not have been captured in the expenditure data? Thanks.
Okay.
Thank you. My question is, okay. Thank you. I hope you can hear me. My question is in regards to the milk presentation. I was curious to know have you done any findings to know in terms of the people who supply this milk to the vendors, if adulteration happens at that point, and were there any results on adulteration on the milk? And then my other question was to Nia. I was curious to know, in this survey that you did that showed that women used to consume more fruits, other fruits than men, is it the same household, or why would there be such a discrepancy that women are consuming other fruits more than men? Thank you.
We'll take one more and then we'll first answer and then we continue.
Thank you, and thank you to all the presenters. My question is to Christine, and it's really looking at the interaction between food safety and the health, the sort of the nutritious varieties of foods that you are surveying. And from a policy perspective, sometimes we have to make decisions on the value you get from the nutrient versus the safety. So when you were doing the safety studies, are there sort of trade-offs that were being considered? I know when we were working with milk, issues of milk in Ilri, one of the situations was that, okay, so there's aflatoxin, for example, in the milk, but the value of the nutrition that you get from the milk is higher than the exposure to the aflatoxin. So for fruits and vegetables and all other commodities that you looked at, is that a factor that you considered? Thank you. I hope I'm clear.
Okay, let's first answer these and then we continue. Neha?
Thanks, Namukulo, for your question. So the way the household consumption expenditure data is collected is that it does not only ask them what they bought, but also it's imputed. So if you've consumed something from your own production, it will be reflected in the consumption expenditure. So that's taken care of. And we can look at more in terms of, are people consuming what they're producing? We actually don't find that. So it's mostly for sales. We don't find that a lot of households are consuming what they're producing. And then the other question, yeah. And the other question about why there's this discrepancy between men and women on other fruits, we don't know. So that's a good question. We can explore why we do have data on whether it's the same household. So we can see, is it across households, or, so we can look at it. It could be the specific fruits that are in the other fruits category. So it could be that they're just preferred by women, but that's something we haven't explored. So we can explore it. Thank you.
So there were two parts to the question. On the first part, there was no direct intervention with the suppliers of milk. So the intervention was really limited to the vendors. But indirectly, the theory of change was that by empowering the vendors and training them on how to assess the quality of milk that was supplied to them, they could demand better quality milk from the supplier. So there was a test, for instance, they did by boiling a small quantity of milk on a spoon with a lighter. And if it coagulates, you know that things have been added to the milk that shouldn't be in the milk, because proper milk doesn't coagulate when you heat it. So they became, the idea was to empower them to demand cleaner milk from their suppliers. Adulteration was tested. I don't recall the results. I think there was no impact, but I don't know what proportion of the milk was kind of found to be adulterated or not. I would need to go back to my ILRI colleagues for that. So apologies for not being able to answer that question.
Thanks, Liz, for that question. So regarding the trade-offs between the nutritious foods and these other safety issues. So for this specific study, we did not do detailed analysis on the safety issues because we were looking at what the different vendors or the different food retailers are supplying or offering to the consumers. And that's where these issues of the different challenges came up, food safety being one of them. However, we know in many of these nutritious commodities like fruits, vegetables, milk, like Jeff was presenting, food safety is a big challenge. And like you mentioned, is there a trade-off? So I think for me, I don't see really, I would say we shouldn't focus so much on the trending off between like offering unhealthy food and saying it, I mean, it's contaminated food, but it is nutritious. We know if it is contaminated, it is not healthy, it is not safe, it is not nutritious. So then we should be thinking of what are the solutions that we need to put in place to address these food safety issues so that we can offer nutritious foods, which are also safe to consume by these consumers. So I think that's the big question, and that's the big policy issue that we need to address to see what's the role of policymakers, what's the role of the private sector, what's the role of different actors, different stakeholders within the food system to address that food safety issue, to make sure that these vegetables, the milk, the fruits are safe. Thank you.
Thank you. Let's continue here.
Thank you, Celine. My name is Crispas Kenywa from the Institute for Food Justice and Development. My question is to Dr. Christine, and it relates to issues of access to the cheap and healthy food versus nutritious food. We know that mandazi is 5 shillings and ndoma or arrowroot is, I don't know how much, 30 shillings, I think. For as long as that continues to happen, and unhealthy foods will keep winning. What must we do to make healthier foods more accessible? My question is more of the activism side, because I'm a food activist. And considering also a lot of the farmers, smallholder farmers, the middlemen buy food from them at very poor prices. So the cost of healthy food at the farmer level is very low, but the cost of healthy food at the consumer level is very high. You see that injustice there? Yeah, that would be my question. What must we do then to sort that issue? Thank you.
Hello, my name is Esther Shuka. I'm a student at Strathmore University, and my question is, how are you looking to combating the why? Why are people looking into the, they'd rather buy the unsafe milk rather than buy marketized milk? And also for the SMEs, we have people prefer buying food from open air markets than rather than buying food in supermarkets and enclosed areas. So my question is, how are you looking into combating the why? And in the rural areas, for example, where we see the farmers, there is high unhealthy food consumption because they are farmers. Everyone is a farmer. Everything comes from your land. So you're not looking into buying healthy foods. So everything they consume, mostly in the rural areas, is you just look for the unhealthy food because everything you have is in your farm or in a neighbor's farm. So how is that also being looked into? And then on the issue of coupons, how exactly is that going to work in Kenya for a country where we see that back to what I was saying on the open air markets, people, there's a connection between unhealthy foods. There's a mindset that marketized things, formalized things are unhealthy. So people would rather go for someone they know, they'd rather go into the informal sector. How is that going to work? How is that going to be combated? Thank you.
Celine, we also have online question.
Okay, let me take one last one here. Then we answer and then we go online and the other side also.
Thank you for giving me the mic. My name is Yarama Hereby. I work for TAT. I have two short questions for Alan and Neha. Alan, you conducted a study in Nigeria, Tanzania, and Vietnam, and you were drawing some conclusions concerning the operations in these three countries as regarding voucher distribution systems. I just want to know, the sites, are they really, can you compare the sites of Tanzania, Nigeria, and Vietnam as synonymous in terms of, because in coupon distribution, the urbanization matters a lot. So does your sample really address the homogeneity of possibility of the urbanization of these centers? For example, if you're in Abuja and you're looking at vegetable, you think everyone has access to fresh vegetable fruits. And so you think everyone has good access. But of course, the cost alone has eliminated so many living in Abuja from accessing that, because the Maitama market cannot be accessed by almost 70–60% of the inhabitants of Abuja environment because of the cost implication attached. So I just want to know what is the uniformity in terms of similarity between these sites where you took. And for now, very simple observation that is maybe very personal, but I see you classifying children from 12 to 48 years. Don't you think really that if we had segregated this very large range of children, we might have different results?
Thank you. Let's first answer those three questions. I think first one was to Christine.
Yes, thanks, Crispin, for the question. Yeah, so what you've mentioned is very evident in many of the markets that the unhealthy foods sometimes tend to be cheap in terms of price and how they are priced compared to the healthy, the nutritious foods. But I think here there are several issues that we need to look at and see how we can address these, because like you mentioned, if you're looking at the arrow routes, where are they coming from? Maybe the supply chain is really long. Okay, is there a way we can reduce that, shorten the supply chain? It creates linkages within those actors that you have direct linkages, or you have shorter, linkages between the producer, supplier. That reduces transaction cost, we increase efficiency, and then issues of thinking about issues of how to create innovations or to bring innovations into the whole supply chain so that we can actually have these nutritious commodities reaching the consumer at a fair price or a lower price, affordable price, and also they are accessible. Then also we are thinking about the issue of increasing awareness, especially for the consumers. Sometimes you find even the prices are not so different, but someone will think, I better take this unhealthy mandazi or, another commodity which is not really good for consumption. But then you don't think about the consequences or the other indirect costs that will come up, for example, in terms of medication and treatment when you get sick, as an example. So that awareness creation to the consumers also is really, really important. And on that note, I'm also happy to share that one of the science programs, Better Diet and Nutrition Science Program within the CGIAR, which is starting this year, continuing from the previous work, but continuing now as the Better Diets and Nutrition Science Program, we'll have an area of work, which is area of work 2, really focusing on these issues that you're exactly mentioning, about issues of affordability, accessibility, and making sure that we are able to supply nutritious food. So we'll definitely share more findings in the next year or so. Thank you.
I wanted to quickly add on the affordability. It's clear that affordability needs to improve, but in the country where I live, in Belgium, healthy foods are affordable and they're still not being consumed. So it's necessary, but not sufficient to increase the affordability. If private businesses could make more money selling healthy foods than unhealthy foods, we wouldn't be having this discussion. So there's many layers to this challenge and behavior of consumers' knowledge, but I think regulation needs to come in the picture as well. Sorry, that was not my question, but I decided to say something anyway.
No, great addition. Thanks.
So on the milk safety, so I only know a little bit about this, but for Kenya, the packaged milk that goes through the large industrial processes is quite a bit more expensive than the milk that you can buy from a vendor. So I think that's the reason. And milk is a highly desirable product by Kenyan consumers. So that's why they choose to go for informal vendors and not buy the UHT or processed packaged milk. I think that's the very simple. So since the informal sector is such an important supplier and source of food, I think it's important for us to work with that sector to improve the quality of what consumers can acquire. Thank you.
Jeff, Alan?
Yeah, thanks for the question. You're giving me an opportunity to hit a point that I missed because of the 7 minutes issue. So we worked in 2 cities, three cities, one in each country. So we worked in Ibadan in Nigeria, in Hanoi in Vietnam, and in Dar es Salaam in Tanzania. In Nigeria and Vietnam, we picked one urban area and one peri-urban area. So we worked in Nigeria specifically, we worked in Abeja as the urban neighborhood and in Bagadaje as the peri-urban neighborhood. So essentially the sample is about half and half between those two, and then half of the treatment group comes from each and half of the control group comes from each. So that's balanced. There's a difference in Tanzania, which is that we just worked in Temeke district, which is a working class area of Dar es Salaam. So we're really trying to avoid places that would have kind of the richer consumers in all 3 cities. The last thing to say on milk actually is that we did have the UHT milk on the coupons. One of the only statistically significant substitution effects we found from giving out the coupons was away from informally consumed milk. So that's a way of combating that problem. Thanks.
I think there were also some questions from Neha.
I think the question about 12 to 48 months was for probably Jeff, because we don't have any children in our study.
And we had children, but I missed the question because you were talking to Neha, but you say 12 to 48 years. It's 12 to 48 months. So the children are a year to 4 years of age. It's all good. It's so much information coming in. So yeah, no worries.
Okay, we have one question online and then I'm coming that way. Nick, can you read it?
Yes, we have 2 questions now online. I am not able to know the name, but it's IJ. So to Jeff, was there any effect on the breastfeeding age children measured? If yes, what was the impact on their diets, especially for the children whose mothers worked in the milk business? To Sebastian, what's the future of bananas in sub-Saharan Africa? I have the impression that banana consumption is going down and often overlooked as important food for a health diet in the communities. Plants in gardens are cut down. And I have one to Francis, please. The co-creation that you presented and showing positive impact in very fragile conditions in Turkana, one of the intervention or one of the area was kitchen garden, poultry, and I was wondering, comparing the options, did you see greater success in either of the three options, or the three options probably performed fairly across the different communities you worked with? Thank you.
So on the breast milk intake, we did not study the vendors or their children. Well, we studied the business and milk characteristics of the vendors, but we didn't look at their livelihoods or their dietary intake or the intake of their children. The focus on the diet was for the children of the customers. We found no change in breast milk intake, and our focus on 12 to 48 was specifically for that, because we really didn't want to promote breast milk in children below 1 year of age. And that message was also given to the vendors, that they shouldn't promote milk as a substitute or something better than breast milk. Yeah, thank you for that question.
Then we had Sebastian.
Yeah, can you hear me?
Yes, we hear you.
Yes, perfect. So yeah, first of all, Sub-Saharan Africa is big, of course, so it's difficult to generalize. Depends from area to area. But let me give you indeed an example of Tanzania, where we did see that indeed plants were cut down and production was decreasing. And in that case, it was because of a disease, right? We all have heard about Fusarium disease, the Panama disease, that indeed builds up in the fields especially if you have banana monoculture, and then the spores can survive for quite a long time. So if you keep on growing the same banana, it will not work, and of course bananas tend to disappear. But again, luckily, we do have diversity, so we do have resistant varieties. That's exactly what we try to introduce there, and yeah, the message is that we need diversity. You cannot keep on doing the same over and all over again, because then, of course, disease builds up, disease pressure builds. And, well, of course, the way that the commercial banana is treated is not an option now, with a lot of input, with a lot of chemical treatments. That's not the way forward. So that's why, of course, we advocate more diversity on our fields. And actually, if we discuss urban production, more remote production, you see that in many areas, urban production of banana is definitely possible. If you have a yard, you can be self-sustainable, and that might be a good solution. So the answer is basically we need to be aware what is locally preferred. We need to be aware what is the local disease pressures. And so with our diversity and further crop improvement, of course, because we can always improve, I'm sure we will get there. Thank you. By the way, while I have the mic, we do have a demonstration of our banana diversity, and I hope that they manage to get them on the right stage to taste them. So next day, so this afternoon, Thursday and Friday, please visit our booth if you want to know more about banana diversity. Thank you.
Thank you, Sebastian. Francis?
Thank you for the question, Nick. I think from where we sit, like we had 3 sets of interventions being selected by the communities, and all the 10 communities in the intervention selected to do the vegetable gardening. And then 3 of them selected to do some table banking or loaning associations. And then 2 others also selected in addition to do poultry rearing. So while that would have been of interest to assess the differences between the 3 different intervention areas, I think the design of our study did not allow us to do that kind of assessment. So we just did an overall assessment, coupling all the interventions together and assessing the impacts.
Thanks, everyone. Purnima Menon from IFPRI. So thank you all, really great presentations. And each of your studies implicitly hit one or more drivers of food choice, right? I mean, accessibility, preferences, and through the comments, we've heard a lot about issues of convenience as well. So I was wondering in your comments, I mean, not specifically to each of your presentations, but could you maybe say something about, what is the future agenda on really driving into understanding and solving these drivers of food choice, doing it in a concerted way, in the same context, in the same time frame, so we actually help the decision makers hone in on what are the strategies that they can pull together. And I'm really, and then if you could also comment on how do we accelerate some of the evidence use cycles, how do we help people do things in context with what we know now? And how do we help them sort of stay the course? I'm very mindful of the fact that we're in April 2025. The governments and partners we work with have things they need to achieve by 2030. That's 4 annual budget and policy cycles between now and 2030. So, just both the future research, but also accelerating the evidence use cycles at this point of time. It would be great to hear from all of you on that. Thank you. Or anyone else.
Yes, my question is for Christine or for Francis on behavior. I work for the Global Forum on Agriculture and Innovation Research. When we talk about international research policymaking, we have competing or complementary research agendas: nutrition, biodiversity, then complementary foods, or addition, and then we have forgotten foods. Now, the most difficult one is to have the right food choice for improving biodiversity. What could be the trigger from a consumer's perspective to go for biodiversity improvement?
Thanks. My question goes to Neha. Again, on age, we see you looked at the age of 20 to 49 years of age for fruits and vegetables. I imagine that if we targeted much younger age group, like younger children or adolescents, that's the age that would probably have higher potential for change, because the older ones, their lifestyle or behavior are more or less formed. Could you comment on your choice of age and why we did not include much younger children, or much younger age? Thanks.
Okay, we'll start with Purnima's question. Maybe we'll get an answer from that corner, maybe 1, 2, maximum 3, and then Christine and Francis will answer the second question, and the third one was specific.
Thanks for the question, and lucky me to be first to answer. In terms of a future agenda, I think a way to pick this up in a more scalable way would be to look at basically social protection programs, and to try to convince the government to test using a portion of the social protection program to allocate to fruits and vegetables. Obviously, from an economic perspective, that's not Pareto improving, because you're taking away choices from people, but that might be we do have pretty good evidence that people eat those foods, those healthier foods, when they have coupons for them or vouchers for them. So that's the direction that I would take that evidence. Thanks.
Yeah, so in Kenya, I think it's very impressive how the Kenya Dairy Board has embraced this and and kind of run with it, to also now work with informal vendors, which is a huge change. I think part of the success has been that the ILRI team has involved the Kenya Dairy Board from the very beginning, from the planning stages, so they were well aware that this was happening. One thing that is clear here, and that possibly made this a bit easier, is that milk is a product that Kenyans love. So you don't need to convince a Kenyan to drink milk. I mean, it's high on the list of foods they really want. For many of the foods we want people to consume more, fruits and vegetables, it might be a bit more of a struggle. So I think it's possibly a bit more challenging for other commodities.
All right. I'll attempt to answer some of your points, Purnima. It's a important one, something that we've been thinking a lot about. I feel like there's a lot of impatience about how can we get there sooner. And if we involve the policymakers and people who are actually implementing things on the ground from the get-go, then they understand the difficulty in getting to somewhere. So I feel like involving them from the very beginning so they'll understand, you know, the issues and how difficult it sometimes is to get to the end point is important. So in Sri Lanka, for example, we've been working with NGOs who are actually implementing things and the government, and they are pretty much on, you know, on the same page as us. So luckily, yet the impatience isn't there yet. There is some impatience among the NGO community, because the very first engagement we did was, well, you guys come every few years and say, let's do this, let's do that. And then you do these small pilots and then go away. And we are kind of left with nothing on the ground. So I think it's really important to kind of come together and make sure that we're implementing something that can be scaled. So kind of trying to understand how you can do that. And I actually had a question for Francis, which I'll ask later, you know, in terms of how do we get to that scale? Like, you know, you talked about scaling of the co-creation process, but then the co-creation process itself is very, you know, it's community driven. So how do you get from a community driven co-creation process to something that's then scaled to a country, for example? So yeah, I mean, I'm sorry, I don't have an answer, but I think working with all the stakeholders from the get-go is really important, so that, okay, so that they are not impatient, because it does take time. There was a question for me about, yeah. So we wanted to target women of reproductive age, just trying to address their undernutrition first, because if you address that, then the children are healthier. So that was just our initial motivation to kind of address women of reproductive age. Adolescents was also another target group that we wanted to look at, but it was more logistical and operational constraints, where we actually we didn't know how we would find them and do a dietary recall survey with them, you know, track them in schools or whatever. So that was more of a logistical thing, but we wanted to kind of look at women of reproductive age.
And finally, the question for Christine and Francis.
Yeah, thanks for the question. So as you phrased in the first statement, I think I see a big role. I mean, the question on how to trigger the consumer side, consumers to increase biodiversity. I see a big role there on behavior change. So like you mentioned, so if we're able to increase awareness of the consumers so that they know actually there is that biodiversity, what are these commodities? When we talk of the news, for example, nutritious and utilized species, luckily like in many countries now in Africa, they're coming back. But do consumers know them? Do they know that what's the nutrition value that they can consume them, where to get them? The issue of accessibility comes in. So it's about accessibility, about awareness of the consumers. It's about policies also, policies that allow or favor, you know, availability of such commodities and marketing of those commodities, and making sure that those commodities are also there for the consumers. And also linking to the producers, not just the consumers, because if the producers don't like producing, for example, the bananas that Sebastian was presenting, then the consumers will not have them available for consumption. So it really connects both the producers and also the consumers. Thank you. And Francis, if you want to add, please.
So thank you, Christine, and thank you for the question. I think just to add to what Christine has already highlighted, I see like to increase biodiversity, there's consumption, there is a big need to address the barriers. And first, we need to identify what barriers exist that prevent people from doing this. So I would give, for example, an example of where we are working in Turkana, where we have been quite engaged over the years in documenting some of the plant species, edible plant species within the community. And to our surprise, for example, we identified close to more than 70 species that exist that can be consumed. But then there is also a lot of things that are preventing people from consuming them. Some of them stem from the cultural beliefs and on the perceptions that people have about these crops or species. To some that also people require even to like from our research perspective, we need maybe to come up with better solutions to make them even more nutritious, coming up with some innovative kind of recipes for people to consume them, to even lack of adequate information on their composition before you can even encourage people to consume them. So I think the solution maybe lies also in addition to what Christine mentions, on just identifying these barriers and then trying to address them one by one. So now maybe to just try to respond to what you intended to ask also, is that we see from our co-creation approach that it is important that beforehand or in upfront when you plan to do a co-creation exercise, you should plan for how you intend your co-creation impact to diffuse to the community. So in our case, for example, we made use of existing structures within the community to be able to make sure that our impacts diffuse to other areas within the community. And that is how we even had some impacts from people who never participated directly in the project. Thank you.
Thank you very much. I'm going to address, I want to try and address your question, Panima, on how do we get to 2030 and help countries to actually go there. Christine made reference to the science program on better diets and nutrition. And in that program, that research program builds on some of the research that has been presented in the room. We are deliberately targeting the evidence that we have generated and that we will be generated to actually feed it into national food systems transformation pathways. We know that the UN Food Systems Summit was actually put in place to try and accelerate progress towards 2030. And countries have developed transformation pathways. Countries are looking for things to do. And so by deliberately targeting those processes at country level, the idea is to try and help countries to at least make some progress on those pathways towards 2030. But in addition to that, because we cannot work in all countries, we have specifically got an area of work where we will be picking up lessons and through regional and global processes, take those lessons there. Many in this room were actually presenting some of these examples at the Nutrition for Growth Summit that just ended recently. And we have this science program is actually a commitment from CGIAR itself to contribute towards the 2030 trajectory. Now, just a quick advert. We have the science program will be presented today at 16 hours in conference room 1. So you can actually hear more there about how we are targeting ourselves towards helping countries accelerate progress. Thank you.
Thank you very much. I'm sorry, Bena, we have to close. Bena is one of the partners we are working with here in Kenya, and in the first round, she would have been able to speak, but we really appreciate your presence, and you can find anybody in the room later. I need to wind up this session. We are a few minutes over time. I think it was a really interesting session, starting with looking at fragile rural drylands and using the natural food environments to co-create and improve diets of the pastoralists. Then we went on looking more in urban vulnerable settlements and the importance of the informal sector, which was then nicely followed also with a presentation by Ellen looking at voucher systems and how we can trigger consumers to make the right choices by using vouchers, and then also looking further down into the sustainability, what happens after. Then we had a nice presentation on milk consumption in Kenya again. We saw that there was not so much impact on the food safety, but the milk consumption went up with 40% in Jeff's presentation. This was then followed by Neha talking in the at the end-to-end approach. So she said there's not only the supply and the demand are important, but again, bringing up that element of food environment, trying to understand what is happening there and how we can drive consumers to make the right choices. Finally, we had a presentation by Sebastian presenting 40 years of collecting different varieties of bananas. He showed us a huge range of diversity in bananas, but also brought out the aspect of desirability, that to bring those huge diversity of bananas on the plate, we really need to work with consumers also on the desirability of banana consumption and bringing out that they are not only having starch, but a lot of other health benefits as well. And Sebastian also talked about how they are using citizen science to engage more with the consumers as well. Finally, we had a very enriching discussion, I think, bringing out also the aspect of food safety again. That's also something we need to look in more and more. Also how the unhealthy versus the healthy foods and how can we really trigger consumers to make the right choices. And how the big question in the room is obviously, how can we upscale these things? If we have some nice results in some places, in some countries, how can we upscale those things, work with the different countries and make sure that we are transitioning in the right direction towards healthy, sustainable diets. With this, I would like to close the session. Don't forget to go and taste bananas this afternoon at the Alliance site. And if you want to learn more about the importance of food environments and consumers, watch out for the Better Diets and Nutrition program. Thank you very much.